good. And you are a fountain of knowledge, and you're very passionate about what you do, and you actually have come up with this innovative formula to help women. So maybe tell us a little bit about what you think about breast implants, what are the issues, and how you've come to design something to help women who have implants.
Okay, so I started this journey as a person who had breast implants, who was experiencing a tremendous amount of symptoms and negative health symptoms, and was very unclear why. And I went to a lot of different types of doctors. This was many years ago now. And I ended up eventually figuring out that breast implants were a big problem for my body. And then when I ended up removing my implants through the correct type of surgery, en bloc capsulectomy, my breast implants were very sticky to the touch, and they were exhibiting what we call gel bleed, or so it's sort of similar to a rupture, except it doesn't really, it's not a full-on rupture where the silicone has moved and migrated, but it's bleeding out its contents. And additionally, I had very thin scar tissue capsule, which is the protective collagen scar tissue that your body makes around any device that you put inside of it. I had very tiny paper thin capsules. So, the likelihood is that the immune system was getting in through those thin capsules and pulling off little pieces of the implant, which is responsible for the gel bleed. Nonetheless, I was, riddled with health symptoms, and I've seen autopsies of women who had severe gel bleed and severe rupture, and we found microsilicone in all the organs of those patients in the autopsies, like in the brain and the organs.
Did they die from the breast implants?
It's unclear, but there's a few case studies that I can send you. They're really interesting.
Okay.
The point is just to see that this microsilicone can move through the whole body, and I have no way of verifying if that's the case in my body, if there's microsilicone in my brain, but if we're thinking about the way we're thinking about toxicity in that way. So early in my career, I was really focused on helping women, first of all, learn about the possibility that breast implants could be the underlying problem in their health crisis or chronic health issues, or even the underlying trigger for an autoimmune disease. And then I started moving into helping women who had explanted but were still experiencing health problems. And then I moved now into this new space of trying to figure out a way to compromise and meet people where they are, because I've met a lot of people who do not want to get rid of their breast implants no matter what I tell them, and a lot of people who are committed to augmenting. So I started to embrace a new approach to beauty, and I have a kind of whole new perspective on it that is...
You were trying to get everybody to take out their implants?
Mm-hmm. I was. You're like, oh. Yeah, right, exactly.